Tēnā koutou katoa. Welcome everyone to this next seminar in the Te Puna Haumaru seminar series. Today it is my absolute pleasure to introduce Professor Susan Dennison from the School of Criminology and Criminal Justice at Griffith Criminology Institute at Griffith University in Australia. Susan is the director of the Transforming Corrections to Transform Lives Centre, leading a transformative system of practice to better support mothers who experience incarceration and their children, to break down intergenerational cycles of disadvantage and incarceration. So really important work, clearly. Susan's also a former Australian Research Council Future Fellow across multiple funded projects. She's investigated how childhood adversity, particularly maltreatment and parental incarceration, affects young people's outcomes. So without any further ado, I'm going to hand over to Susan.
Thank you so much, and thank you for the invitation to present our work today, and thank you to everybody who is joining. Yes, so I'm going to talk to you today about our Transforming Corrections Transform Lives Centre, and really kind of take you on a bit of a walk through where we began and where we're at now, because it is both kind of a research in action kind of project, and also we are delivering a whole range of activities as part of our work as well. So I want to kind of give you a bit of a snapshot of as much as possible, and then also spend a little bit of time talking about our research evaluation framework as well for the work that we're doing. I'm the director of the Transforming Corrections Transform Lives Centre. We have a very big team, and I'll tell you a little bit about work that different people are doing as I move through this. But first, I just want to acknowledge that I am coming from the land of the Yagara and Turrbal people here in Brisbane, Meanjin. And we also deliver our work in Townsville on the land of the Bindal and Woolgoorikaba peoples. I want to acknowledge any First Nations people who might be joining us online today, and really appreciate the opportunity to do the work that we do on the lands where we are, and have really important discussions that really hark back to the ways that people came together traditionally to learn and to share knowledge and to grow and improve the way that we can be and enhance the wellbeing of our communities. This artwork that you can see is actually a First Nations graphic designer created this artwork for us, which actually tells the story of the women and children who are part of our program, and the various communities that come together, our staff, both our researchers and our clinicians who are working with families, and the journey that we're going on together, and the transformation that we believe is possible. So I won't talk to you too much about the different symbolism that's in the artwork, but I just thought it was worth sharing that because it tells a beautiful story of what we're doing as well. So in terms of our centre, our broad vision is that we are aiming to support mothers and their children to have safe, dignified and fulfilling lives, to break down the intergenerational cycles that we know are created through disadvantage, but also to break down those intergenerational cycles of incarceration as well. And we want to do that by transforming systems and generating new knowledge for evidence-based programs. So that's our vision that we come back to constantly in the work that we're doing, and making sure that we are sticking to the core objectives of the work that we're doing. But it also is a vision that we came together with as a centre as we move through our work and before we started the current work that we're doing. There's a few clues in there as to what we're doing. So one is that we're supporting mothers and children in the work that we do, but we're also working to transform systems. So we are not only program focused, we're also systems change focused, and we are also research focused. So we are also looking to generate new knowledge and create an evidence base for what works. So we are a team of researchers, practitioners, and we're collaborating with people with lived experience, so primarily mothers with lived experience and their families, as well as other service providers in the sector. And when I say the sector, I'm talking about not just the criminal justice system, but also general social services sector, and then across government in terms of corrective services, but also a whole range of agencies, whether we're talking about education, health, child safety, youth justice, and so on. So it's a whole of government approach in terms of how we're trying to create change as well. So we know that collaboration and these building of strong relationships is important to bring that shared vision to life. And part of that is identifying that we actually do have a shared vision for the future as well. And we are, here at Griffith University in the Criminology Institute. So we are, I think, reasonably unique. I wouldn't say that we're the only people doing what we're doing, but I think in the way that we work in terms of that really strong collaboration between researchers and practitioners is fairly unique to be based in a university doing the kind of work that we're doing, particularly outside of, it might be more common in medical or health setting or even psychology, but to be doing this in a criminology school I think is fairly unique. I'm going to talk a little bit about how we came to be doing delivering the program and the systems change work that we're doing right now, because it really started in what we call our phase 1 of TCTL. So TCTL is just Transforming Corrections to Transform Lives. We started this back in 2020 when we originally received funding. And I should say that we are funded through philanthropy. So that funds all of the work that we do, apart from some contribution that the university also makes to our work. But it's primarily philanthropically funded. And we originally got some funding back in 2020, and that was really to design a model to better support mothers and children impacted by incarceration. We had made a strong case for why mothers were not currently being supported adequately, and that there was also an intergenerational focus that was being missed in current services, and there was a real opportunity to do more. So with that, and that was really building on my background as a researcher, which had focused on the impact of incarceration on families and on the parents themselves in custody as well. For the last 20 years, I'd been doing that research and really building up knowledge around what I was seeing in terms of people engaging in different services and programs, but also what seemed to be missing, and slowly trying to think about it as a whole of system problem and not a family specific problem that needed to be addressed. And then how do we actually go about doing anything? Everything that I came up with at that point in time was just big and complex, and I didn't think anybody would want to fund it. And then we had the opportunity to work with the Paul Ramsay Foundation and to have the opportunity to actually develop the idea a little bit further and work through this co-creation process. So in doing that, we really drew on some of the implementation science literature, particularly Deborah Garte's work, thinking about what does the design and implementation and evaluation of programs look like, what should it look like, and really thinking about those first phases around understanding what needs to be done, and then what an strong implementation framework might look like. But that work didn't really unpack exactly how to go about that co-design or co-creation process. And we knew that we wanted whatever we designed to actually be coming from women who were incarcerated. We wanted to build on their experiences and what they felt would work. And we really wanted to understand from their perspective what's not working now and what's not working while they're in prison, what's not working for them when they're released from prison as well. So there's lots of literature that you can draw on from that, but we wanted to hear their accounts of what actually they felt would matter for them and would make a difference for them. We used then the Design Council of the United Kingdom's double design framework, and in particular they have a systemic design framework that is kind of an adaptation of that double design framework, and that's the model that you can see on your screen now, which is really kind of working through 4 key steps. The first one is an explore phase, which is really about thinking about how do we understand the problem, and how do we go about understanding the problem from different angles and different perspectives and using different methodologies. And I won't go into it in lots of detail because I'll use up the whole presentation time just talking about this model, but it gives a lot of different, a lot of guidance about different ways that you can go about that, not specific to our particular challenge that we were wanting to address, but what you could do it in relation to complex systems design and social services. It was really geared towards how do we think about improving social services. Then the next step is to kind of work through the reframe process, and that's about, as you are going through that explore process, it's really important not to be closed to thinking about what you believe the problem actually is, but to be open to actually reframing what the problem might be and how you might need to go about it. And so those were the first kind of 2 key steps that we went through, and that really took from beginning to end 18 months, not that much time in terms of all the workshops that we did. They were a bit more truncated, but from beginning to end, the whole process really was 18 months before we moved into the create stage. So I just want to talk through a little bit about the workshops that we did that really informed that explore and reframe stage that we were in. There's other pieces of the work, so you can see there part of the model also talks about orientation and vision setting, the importance of connections and relationships and leadership and storytelling in the process. So they all feed into how you go about doing the explore and reframe stages and then moving through to creating a new design and then actually implementation of it. So they're all key parts of it, but I don't have time to talk about it. But I do just have a paper that talks through this whole process and how we developed and delivered it in relation to this framework. So that paper's under review at the moment. So I hope that later this year that we'll have it published and that you can be able to read about it in a lot more detail. But really, in terms of the explore stage, we broke it down into a series of workshops. So the first workshop, and it was a series of workshops because we went around to all the different women's correctional centres. Actually, we went to 4 women's correctional centres. So there's actually 5 in Queensland where we're based, but at the time one of those correctional centres was privately operated. So we only went to the state operated women's correctional facilities. That correctional facility is now state run and is part of our program. So when we did these first workshops, it was really about giving the women an opportunity to be the experts in guiding what needed to be done around the development of a program. And so we didn't focus on, well, what should a program look like, but really about understanding what were their needs from before they came into prison, what did life look like for them? And then from day one in prison, what were their needs? What were their worries? What were the things that they wanted access to that they weren't getting access to? How did that change over the first couple of weeks that they were in prison? And then how did that change over the term of their custodial sentence? And then what did release look like for them? What were their needs and concerns leading up to that? And also after that release period, we had about 70% of the women that were in our workshops had previously been in prison before. So they were really able to speak to what their hopes and plans were for them upon release, and then what changed when they were actually released, and what difficulties did they experience that led them back into a correctional centre again, and what would have made what did they think would have made a difference for them next time. So we really unpacked that through a series of different activities that people did, and people moved around different tables during those workshops and were able to add value to the discussions that had already been had at those tables. So it was an iterative approach. We did it in workshops of about 12 people were in a room, generally at any one time. Sometimes it was closer to 16, but then we did little tables of 4 people, so that we had the opportunity for people to have that time to share their stories. We tried to create a good environment. We provided morning tea or afternoon tea for them during it, and it was really about conducting a workshop as you would do in any setting in the community was really about that kind of respect and valuing the contribution that they were making, which was a little bit different. And, we worked through some processes with corrections to ensure that we could run those workshops the way that we wanted to run them. We then did the similar workshops with service providers. So we did those out in the community, and we asked the same questions as well. So we had representatives from all the different government agencies, and then also NGOs that were providing services to mothers in either in prison or after release from prison, because we wanted to understand what was their understanding of mothers' needs during this time, and how much did it actually align with what mothers were telling us as well, and where can we identify where there might be gaps in knowledge and understanding as well. We then did a series of workshops that focused on children and young people's needs as well, and we did that one with service providers. We didn't feel that it was appropriate to bring young people to the table at that point in time who were impacted by having a mother in prison, and the mothers had shared a lot with us in their workshops about the experiences for their children, and so we were drawing a lot on that knowledge, and then also looking at service providers who were working with children to add extra information at that point. We also wanted to know how were those agencies actually working together. So just in terms of like what we learned, and I will whip through this quite quickly, mothers told us about how they have concerns regarding the whereabouts of their children. So when they first come into either the watch house and then into custody, or from court and into custody, they often don't know who's taking care of their children, where are their children, have child safety come in to assess whether their children need to be placed elsewhere, who's communicating to their children about their whereabouts. So there's a lot of concerns in that first day, that first week or two, even while they're waiting for to be able to make contact with their children as well, about who's talking to these children, who's caring for these children. For pregnant women, there was a lot of information around how being in imprisonment adds to their vulnerability, but also their isolation about what to expect out of their pregnancy, and working through that prenatal and postnatal period as well, what to expect, and to be able to get the kind of advice and support that you would normally be able to access in the community is not being matched in the correctional environment, which isn't to say that there's not midwives who visit the women and they're having health checks and so on. But in terms of that kind of network of support, they're very isolated, and also isolated from people who mean a lot to them when they're going through a pregnancy as well. They need support to maintain relationships with their children, and sometimes to repair those relationships with their children, and to continue to build relationships with their children over time as well. They had a lot of difficulty, this is unsurprising, communicating with child safety. That's the name of our child protection organisation. So difficulty contacting staff, with phone calls that are 6 or 7 minutes long, often waiting on hold and not being able to get hold of the child safety officer, not even knowing who's the child safety officer who is responsible for the order that their child is under, confusion around policies and orders and what they need to meet in order to be able to work towards reunification when they're released, whether their children are under short-term or long-term orders, and then a lack of involvement in case planning, so not being able to be part of family group planning, not being at the table when decisions are made about their children and where their children are going to be best placed. So they want better contact with children, they want support to return to the community, and particularly to be able to reunite with children, and sometimes that might not mean being reunified immediately after release, because there are challenges around finding suitable accommodation, furnishing that place appropriately to meet any requirements from child safety, for example, but and housing is a particular problem. It was a problem then in 2020 when we did these workshops, and it's an increasing problem now with the housing crisis. But also importantly, they want opportunities to start healing and changing while they're in prison. So as we know, women's pathways into prison generally have a history of domestic and family violence, early childhood victimisation, trauma, mental health challenges, substance use challenges. And so that time in prison is a time when a lot of the outside world stops, and but that trauma is sitting there for them, and having an opportunity to actually start to move forward from that trauma is something that they would like while they're in custody. But the psychological support that's available while in custody is really focused on risk assessment and program completion, rather than and really maintaining the safety of women. And so that risk assessment is really around self-harm and suicide risk, and it's certainly not able to actually work with women one-on-one around trauma or around kind of that therapeutic engagement. So that's what they're also looking for. In terms of the children and the young people, service providers, and I won't really go into all the things that we learned that children and young people need, but what really came out of those workshops was the system barriers that get in the way of children being actually supported and often being invisible in this whole process of maternal incarceration. So that there's barriers to information exchange. So children generally have needs that sit across a number of government agencies, but also other service providers come in, NGOs come in to work with funding from those government agencies. So whether we're talking about education, health, child safety, youth justice, contacts across all those agencies are often occurring, but they're occurring in isolation from each other, and agencies are not sharing information. And this goes for the mothers in prison as well. There's a lack of awareness of what other services are available, and particularly for the agencies like education and health, who aren't as well connected within the criminal justice system. There is a real lack of awareness of what the needs of children might be who are impacted by incarceration, and then also what services might be out there that are suitable to actually support young people, and then there's no integration of those services. So sometimes you've got services working with the same person, doing similar support work, and being completely unaware of what each other is actually doing. That this is really overwhelming for families in terms of the number of services, the number of government agencies that they're interacting with, and how they actually access support. So that complexity means that for a lot of families, they're not accessing support. It's too complicated. It's too hard. There's too much paperwork. There's too many people to talk to. There's too many times that you need to share your story in order to get support. And that's a real disincentive for anybody to engage. And that same story goes for women and their trauma and their retelling of stories as well. What they needed, they talked about, was a single point of trusted contact. Interestingly, none of the agencies felt that they should be that single point of trusted contact. They felt that as government agencies, that it wasn't their role to be kind of that coordinator, and that also the trusted element for some services for some agencies, they're seen as very interventionist, and particularly for First Nations people have been very interventionist. And so that is, that's not a role that they can play. For the NGOs, they kind of felt that they didn't necessarily want any NGO to hold that space and to be that single point of contact, because it might leave other NGOs out. So having a level of independence in it as well. And then the need to actually get support and intervention for families at the time when they need it. And we really worked through a whole range of case studies through these workshops that identified opportunities to support families a lot sooner, to support children a lot sooner, and the repercussions of not providing that support, and the ripple effect that not sharing information appropriately also have for the consequences of children and mothers as well. So we then worked through, we drew that information together. We had well over 100 hours of recorded workshop material that then got coded and analysed. I won't kind of go through that. We then worked through a model development stage where we drew on other research material that we had, other data that we held around an ARC project that I'd run around that focused on incarcerated mothers. We looked at journey mapping. So we had life event calendars of mothers from a different project, and we looked at their journey through systems and different needs that they had over different time, and also the needs that they had that overlapped at the same time. And we used all of that information to try and come up with a model that we felt captured all the concerns, the needs, the must-haves that women talked about that would make a difference for them. And as part of that model development, we were also very conscious that we were no longer developing a program in isolation, that we really needed to tackle the systems change, the system barriers that kept coming up in every single workshop that we had. There were system barriers that were being talked about. So we knew that if a program was going to work effectively, we were going to have to tackle system barriers, because we know from the implementation science literature, if you try and just put another program out there where there are all these barriers, and those barriers are just going to push back on that program, and it won't actually achieve the goals that it's intended to achieve. So we knew we had to do a piece of work around that as well. In our fourth series of workshops, we went back to the mothers in prison. This was about 6 months on from our initial workshops, and we took them the model, and we got their feedback on it, and we invited them to change anything that they liked. If we didn't get funding for all of it, what has to stay, what could go, is there anything that we've missed? We were really open and just said, this is a program for mothers, and it's not our program, so please, reshape it in any way that you like. For the most part, they were incredibly happy with the model that they were presented with, and they gave us a little bit of feedback where we created a few tweaks to the design. We shared information back with them, so we created posters based on what we learned from the workshops, and these posters were presented to them and put around and given to represent different representatives from each of the different sections of the prison, the mothers themselves, and corrections gave them permission to put them up on public walls within the prison, so that they could share that information with other women who were not part of the workshops. It was also really useful to have that these posters visible, so the staff could see what we'd actually been doing in the workshops, and to read this information as well. These posters are actually in PDFs on our website, so you're very welcome to go and download them if you would find them useful, and pass them on to anybody. Print them. We're very happy for them to be used. The model that we developed, this is the kind of simple version of the model, was essentially a program which focuses on providing support to mothers who are incarcerated and their children. We have a systems change focus, which sits under the Transforming Corrections Hub, and that's a range of activities that I'm going to talk through as well. So that was really about, we'd called it Transforming Corrections Hub, and because really we were focusing on corrections as being the point of contact that all these other agencies need to be able to come to in order to provide better support. But when we talk about systems change, we're not just talking about the correctional system, we're really talking about all those other social service providers and systems that interact with the criminal justice system as well. And then we have a research and evaluation component. So, what we're trying to do is create that system improvement. We know that there needs to be knowledge exchange that happens between both the program and the systems change pieces, so that we can both can learn from each other in terms of the delivery of a program. What can we learn from that around system barriers, and how can we then work within the hub to change those system barriers that then has a flow-on effect back into the program, and to develop that evidence base. So that's the simple version. I'm now going to show you some less simple versions of what we're doing. So our program, this is our Transform Lives program, and this was designed by the mothers with some support from us to focus on meeting their needs, and really at the centre of this is the mum and children, and then really anybody else who's important in her life that we'll provide support to, but the core focus of it is the mum and the children. She's supported by a Transform Lives coach. So these coaches are clinicians. They have a range of different degrees and experience. We have some social workers, we have human services services. We have people with varying additional degrees, a master's in art therapy and so on. So we have people who've got program qualifications to deliver domestic and family violence support, parenting programs and so on. So we have coaches that have a range of skills that we can work directly with the mothers and children around. So each mother and child has a coach, and that's their coach that walks alongside them for the journey of the program. But coaches can also co-work. So if we need a coach that can do some art therapy, we have all of our coaches actually being trained to do some art therapy work, but we have a coach who can actually come in and do specific modules that focus on trauma as well. Or we have a coach that might come in and run a program for domestic and family violence, for example, or a parenting program that meets the needs of child safety so that the mothers in the program can achieve the goals that they're working towards as well. So that's why we have a variety of different skill sets within our coaches. So the coach's role is really to provide 24/7 support, and that seems extensive, but that's what women and families really ask for, because a lot of crises happen outside of a 9 to 5 kind of day, or often an 8 to 4 day where services work, and to be able to access support. So our support that's offered outside of business hours is an emergency call process where our coaches are on rotation for a week at a time to take calls outside of hours. They will generally only take the call and triage it over the phone. In rare instances, they'll go out to a mother if needed, but it would really be about understanding what the need is and triaging it over the phone. We don't want to put our coaches in risky situations either. So it will really depend on whether police need to be called as well, depending on what the situation is. They're there to develop a strong therapeutic relationship with mothers and children, to provide individually tailored support. So the whole program, there is no program manual. We have a practice manual that has guidance around practice principles and what we're trying to achieve, but everything should be tailored to the individual needs of the mother and the children. They're there also to provide integrated service provision. So their role is to also be a navigator for mothers and children for all the other supports that they might need, the agencies that they're interacting with over time as well. So that navigator role is kind of really critical, and was something that we was really pulled out of all the workshops that we did, to have that kind of independent role, and be able to work alongside all the other agencies. We were really clear that we didn't want to do a program that was duplicating other programs that were out there or duplicating any service. So coaches are not supposed to do everything themselves, where there's actually an agency that is funded to do a particular piece of work, and that's going to be beneficial to the mother and she would like to engage in it. Then it's our coach that will help link the mother into that particular service and do really warm handover and even attend some meetings with that service if that's necessary. We're not trying to take away from other services that are out there. We're really trying to add value to what's already there. They're there to provide improved information exchange and also provide that continuity of care. The ring kind of that sits around those then is really focused on the different types of support that both mothers in prison and families shared with us that they need support for, and what we know has come out of the literature in terms of support for children as well. So I won't dig into those too much now. In terms of the delivery of our program, we commenced our program in Southeast Queensland in January this year, and we commenced it in Townsville in June. So all of our correctional centres sit either in Southeast Queensland, and we have one women's correctional centre up in Townsville. So that's why we've got those two locations. We have a program manager who supervises 4 program coaches in each site, and then we have 2 program assistants. And the program assistants are really there to provide administrative support a lot of the time. There's a lot of paperwork that needs to be filled out, a lot of sharing of information that needs to be done, consent forms around different information sharing processes. They can also help with getting IDs for women and getting them linked up with, Centrelink bank accounts, all of those sorts of things as well. And they will also do some running around. So they might help take children to play appointments that they need to get to. They might help take mothers to appointments where they need to get to as well, particularly in that first week or two after they've been released from prison. So they will support coaches in different ways depending on what's going on at the time, and particularly we'll do a bit more hands-on work when women are released and might need some assistance as well, whether that's doing some supermarket shopping with them and things like that to provide some additional support where that might be a really overwhelming experience for them. Most of the face-to-face contact is through the coaches with the mothers and children, but we do call on the program assistants from time to time. One program assistant in each location is actually a social work student who is doing their a paid placement with us. They have to do 500 hours of paid placement before they they graduate. For a lot of social work students, particularly those with their own lived experience of adversity, it's very hard for them to get those 500 hours done. So we offer a paid placement. As a program assistant, so we have rolling one position in each location, that it's a rolling 5-month position where we have students come through that. And it's also a really great opportunity for them to be in this setting and to be training some future coaches as well. Our eligibility criteria for the program is that mothers have to be returning to a location that's close to where the program is being delivered. So the Southeast Queensland region or Townsville and surrounds. We'll go down as far as Bowen actually. We can't make it up as high as Cairns in North Queensland, but we'll travel about 2 hours from the centre of Townsville, and likewise for Southeast Queensland, about a two-hour radius is what we'll travel. So they have to be returning to one of those locations. They have to have a child under the age of 17 who's also willing to participate in the program. They also have to consent to be part of the research process. So it is a trial. We have research that's being collected throughout the trial. They can't have committed an offence against the child, and they can't have a border force flag, so if they're being deported after release. So those are pretty much our criteria. And in terms of risk assessment, they have to be moderate to high risk of returning to prison because this is an intensive program and it shouldn't be offered for people who are reasonably low risk. So we also look at the risk assessment tools that have been completed to bring women into the program as well. Happy to talk about that more in questions if you've got more questions about that. We're funded and through until mid-2027. So by that stage, we'll have about 115 mothers in the program and their children, so roughly about 230 children. Our coaches take one mother each every 3 months, and so at the end of every year they should have a caseload of 4 mothers that they then carry forward. We work with mothers for up to 6 months prior to release from prison and then for up to 3 years post-release. That support is also for the child for that entire period of time as well, or children. We also work with adult siblings. We also work with carers, other family members, grandparents, whoever's in that child's family kinship kind of system. We'll work with them to support them as well. Sometimes that's around providing support, advocating for them to retain housing, things like that, where we've done that with carers as well. It might be working with teachers in schools. It might be working with adult siblings because they're also having children and they're also sharing some caring responsibilities for a child in our program. And really we're about intergenerational change. So we will branch out, but the core people in the program, are the mothers and children. We're looking to improve key areas for mothers that are preconditions for change. So building up knowledge and skills, looking at changing behaviours, healthy habits, attitudes around not just kind of criminogenic attitudes, but attitudes around engaging with different organisations, services, building trust, and so on. We're looking at improving relationships with children, their capacity to engage in mothering. Whether that is being reunified with children or not, we're very clear we are not a program that is actively reunifying mothers and children. If that's the goal, we'll work to support that goal, but that's also going to be dependent on what child safety, what orders are in place around that as well. We are focused on building stability and wellbeing for women, supporting them to build that. We do use an empowerment model, I should say. So it is about, we provide a lot of intensive support as we start, but it's really about walking beside the woman, and then eventually we want to be walking behind her. So she's actually leading the way, and she's leading the engagement that she's doing with other supports and services, and kind of scaffolding up. It really works around kind of Maslow's hierarchy of needs, where we're kind of there really supporting getting all those basic necessities in the first instance, and that stability in their lives, and then kind of being able to build up from there. And as they move further up, they should be actually being empowered to be able to lead that work themselves. Having an improved sense of self and identity, and increased time to reoffend. So we do have targets. We don't have percentage targets or anything like that around reducing recidivism, but ultimately that is a goal. But we think that if we can achieve the other things, the recidivism really kind of takes care of itself, because mothers are generally in the criminal justice system because of their adversities that they're experiencing in their life and survival, rather than because of a desire to engage in criminal behaviour. So if we can actually create that stability, we can address recidivism. For the children, we're really focused on ensuring that their needs are assessed and supported. So we know a lot of children progress who are living in families that are dealing with a lot of crises, and often it's constant crises and a lot of adversity and disadvantage, and don't have the ability to bring in services to be able to assess their children around the needs that they might have. And often early in school, those needs are seen as behaviour problems, and lead to suspension, school expulsions, and so on. By the time they're at the end of primary school, they've already disengaged from education completely for some of these children. So we're really about ensuring that the support is there to get needs assessed, whether they're neurodevelopmental needs, behavioural needs, health needs. And, we've just commenced working with a child a couple of months ago, and it was very clear to the coach that we needed to get that young person assessed pretty quickly. And we've got really great collaboration with an assessment and referral team who have prioritised our program in terms of being able to do rapid assessments for us, where we would otherwise be on wait lists for maybe 6 months, 12 months to get assessments done. And that young person's already been assessed, diagnosed with 4 different needs, and that are so substantial that young person will now have additional in-home care, and also additional support in school with additional worker in the classroom with them. And this is going to be quite life-changing for that young person. And that person was actually under an order, so under guardianship with our Child Protection Agency, and had not been assessed for a number of years. So to be able to come in and provide that kind of support, I think, is really important. And it's very heartening for us on the research side of things to see that that kind of support is actually, that what we intended is actually happening on the ground as well. We are about improving health, children's engagement and attendance at school, but it's really about their engagement, a sense of belonging in school, feeling that there's a purpose going to school, feeling safe going to school, and feeling like they belong there as well, which we know will improve then their attendance and their success at school as well. Creating a strong support network around them, improving their relationship with their mothers as well. And that's part of kind of that eligibility criteria, that this is something that that is going to be possible to kind of work around. Reducing contact with child protection system and reducing time in out-of-home care, they're also our goals. And reducing risk for youth justice and criminal justice system contact. This is our Transforming Corrections Hub. We have 3 key pieces of work that we're doing within this, and this is we have a training piece that we're doing that focuses on working with correctional staff. So that training package is almost ready to go. It's really addressing concerns that women had about not having interactions that help maintain their dignity while in prison, not being treated respectfully, and the impact that then that has in their behaviour in prison and also their ability to move forward in life as well. So we have a training package that's going to be rolled out across the women's correctional centres for staff around better understanding the needs of mothers in prison, women in prison more generally, as well as mothers, but also is really about skill building in terms of the soft skills and their interactions that they have with women, and assumptions that they might be making as well. So we're hoping that that's also going to improve their communication skills with mothers and help create a safer environment for them. We have just commenced a community of practice both in Southeast Queensland and Townsville that's led by our program managers, and that's about bringing together frontline service providers from across the sector to be able to enhance that shared understanding of young people and mothers' needs that are impacted by incarceration and how we can better work together. So it'll be about unpacking some case studies, but it'll be also about enhancing decision-making around information sharing and utilising some tools that we've been developing around decision-making as well for information sharing and understanding the flow and effect of that, and really about building those relationships across the sector so that we can have better integrated service delivery as well. And then we have a systems change board. This is really a representative from the senior executive of each government agency is on the systems change board. And the focus of that is to understand what the system barriers are, to problem solve those system barriers and to create an authorising environment from the top down of each agency to be able to create that flow through the agencies to improve integrated service delivery and information sharing. And so we're working, some of the pieces of work we've done there have been policy audits around information sharing, creating decision-making tools around information sharing as well. And then those tools are moving into the community of practice as well. So we're really trying to tackle some of the big barriers around why don't family group meetings happen inside correctional centres for women? How can we better support women to get access to housing? What are some of the practice areas that we can improve in relation to child safety, but also mental health and health support for women exiting prison? So really trying to look at how do we create continuity for a woman exiting prison as well around these systems. So there's a lot of goals. We've got a lot to achieve, but we've got a really great engagement across government for this systems change board. Our research, we have kind of research that sits underneath every aspect of what we're doing, the systems change board, training, community of practice, but we also have some broader work that I won't go into that also sits within the systems change kind of work that we're doing. And then within the program, we're doing process evaluation, we're looking at individual level change. So we want to understand, we really want to unpack the mechanisms about how this program creates change for mothers and children and where we succeed and where we don't succeed in creating that change. How can we improve the program over time as well? We don't necessarily think we've got it all right. So how can we learn and how can we improve? We'll be looking at between groups change. So we'll be utilising QCS data as part of that to be able to understand our outcomes relative to women who haven't been part of the program. We do not have a randomised controlled trial. We'll do some propensity score matching down the track and we'll select in women using QCS data to really just look at trajectories over time. But we didn't believe that this was... we don't have a wait list and we don't have a randomised control trial where we have a group that are not that are aware of the program and are not getting it. We also are looking to create linkage across all the government agencies for data so that we can look at long-term outcomes and particularly to be able to look at cost savings over time of investment in a program like this. I won't go through all of it, but I'm going to hand over to questions in a second, but I just want to kind of give just a quick overview because I'm sure that there's a lot of researchers listening to this and you're probably wondering where all the research is. So In terms of our framework, we use for the trial of our program, we're using a realist evaluation framework. I won't be able to unpack that in this time, but really we're drawing on what is the context for the program in which we're delivering it, what are the mechanisms that we are hoping will activate change and support for mothers and children, and then what are the outcomes that we're measuring. And so the context is really about the background factors, both at the criminal justice system level, the broader kind of, I guess, ecological context that this program sits in, but then also what is the historical experiences of women who are in this program. So we're capturing information around all of those context elements. The mechanisms relate to the activities that the coaches are engaging in with mothers and children, and then the outcomes we've really broken down into short-term and long-term outcomes that we're interested in focusing on. So we have 5 main sources of data within the trial that we're collecting. We have standardized research measures, and we have 4 waves of data collection happening around that. We took a long time, and I can't do it justice. We took a long time developing the package of research measures, and we've really only completed the development of them for wave 1, which we're in at the moment, and we'll soon be starting wave 2. So we're getting ready for wave 2, but we spent a lot of time thinking through what are culturally appropriate measures to be including where we're using standardized measures. We did an audit of all measures that have been developed by First Nations people for First Nations people, then measures that have been developed by non-Indigenous people but validated on First Nations people, and then other research measures. And we really looked at those with a preference to utilising First Nations developed measures where we could, and then building other measures around that would supplant the domains that we were really missing, and whether or not they were appropriate. And if they were not appropriate and hadn't been validated for First Nations people and they weren't culturally sensitive, then we didn't use them. So we're comfortable with the measures that we've got. I think that there is a real lack of a lot of appropriate measures for First Nations people, and so we pared things back where we just didn't believe that they were appropriate. But some of the things we do have a First Nations resilience measure, growth and empowerment measure. We also kind of abandoned some measures and decided that we'll explore that domain through semi-structured interviews and yarning for First Nations people, as opposed to kind of, as our clinicians like to call them, tick and flick kind of measures. We have a life events calendar, and we actually have multiple calendars. So various domains are covered through life events calendars as well, and this really gives us rich information about the life of women prior to coming into prison, and then so we commence those calendars while mums are in prison, and then they will be ongoing, so they can add to those calendars over time, and then we'll get a final update of those calendars at the conclusion at wave 4 of the program. So those calendars cover domains around accommodation, relationships, domestic and family violence, substance use, health and wellbeing, mental health, victimization, as I think those are most things, housing, education. And so we have these calendars, and the coach will just do a calendar at a time with them. So it'll just be covering one domain where they kind of map things over time. And I have to say the coaches were a little bit reluctant about what these might be like when we first developed them. And they absolutely love them now. So the feedback has been that the women really enjoy doing them, that they're learning a lot from the women that would take them a lot longer to get over time. And they're getting a lot of information quite quickly, and it's helping them to actually then engage, develop their case plans with the women, and really unpack some of the, in further conversation, some of the information that's coming out of this process. And then we have semi-structured interviews that will be forthcoming, which can also be done through yarning modalities. Oops. sorry, waving my mouse around. We have a case management system, which is all the coaches input all their information into their case management system. So that sits separate from the researchers, but we can pull data from that at regular intervals as well, which we then put in secure sites. It then gets de-identified against every woman and child in the program has a code that gets replaced with. But that gives us really rich information, which will help us with understanding the mechanisms as well as outcomes that are not being collected as part of our data. And then we get corrective services data. So we actually get corrective services data statewide for all women in prison every 2 months. That supports our intake process, but we can also get data as requested at different intervals in time to support the research process as well. And then we'll get a final selection of all data at wave 4 as well, to assist us with the propensity score matching too. I'm not going to go through all of this. This is really just to say that wave 1 and 2 focuses on collecting data around the context and the baseline. Wave 3 focuses on short-term outcomes, and wave 4 long-term outcomes. This is really complex. You'd probably say, why is wave 1 and wave 2 context and baseline? That's really because we had them quite separate, but what we found was that women were coming out of prison quite quickly in some situations, so we have a really high remand population. So once they're actually sentenced, and we take sentenced women into the program, their period of time serving their sentence is actually quite short. They're already eligible for parole by the time that they're sentenced. So we're working around, well, what's their parole? When are they eligible for parole? When is their parole application going to be heard? So we work with them for up to 6 months. In practice, that can be 6 months for some women, but sometimes it's more likely 3 months. We were not getting through all the research measures in that time because the focus at first is obviously building that therapeutic relationship and actually meeting their needs. Research comes second in any engagement. So we had to kind of shift our wave 1 so it occurs pre-release and in the post-release period. So wave 2 kind of got pushed a little bit. There are some questions that are just not appropriate to ask as baseline measures while mothers are in prison. It's a very artificial environment. So thinking about routine activities, thinking about healthy behaviours, thinking about parenting and things like that are not questions that you can be asking in a correctional environment. So we move them to wave 2 and they then get kind of asked at the 6-month release period. So this is the last slide, we please know. Basically, this is wave 1 commences when somebody enters a program. It is ongoing here in terms of the green, not because it goes through every wave of data collection, but because wave 1 will be running through the life of the program. We will always be bringing women into the program over the life of the program. And so wave 1 is just a permanent feature now that it's commenced. Our first participant commenced in January 2024. And that wave 1 really goes over entering the program and into the release time as well. So up to about 2 months after release, we're still collecting some of the research measures. Wave 2 commences 6 months post-release. And so our first participant is ready for that in October. And so that's when our wave 2 will commence, and then that will always be running as well. Wave 3 will commence next year in October. Wave 4, April 2027, and then we'll do a brief exit survey as they conclude the program. So our wave 1 happens about 6 months before they transition out of the program, but that's really just the commencement. Those measures will take kind of a 2 to 3 month period to complete, and there'll be interviews in that process as well. We didn't want to put it right at the transition out of the program time because we think it's unfair to be focusing on the research as they're exiting out of the program. That should be like a really soft, gentle kind of exit. So that'll just be a really brief survey that happens there. The main part is really at that 30 months, 2.5 years post-release. That we're getting the main longer term outcomes that we'll focus on. So you could see in the left-hand column how many women we'll have at different points in time. So yes, it does get more depressing as you move down the waves, that we'll have less people who have actually completed those waves at the end of our funding. But the goal is that we are working towards ongoing funding post June 2027. So and we are having discussions with the foundation as well about at least providing funding for the women in our program and children in our program to complete the program if they're coming into the program quite late, even if it isn't going to be continued as a recurring program, that we at least get to complete the program with all women in the program. So we will continue to build up that data post June 2027, but that's where we'll be at the end of the first part of our trial. This is what the whole model looks like in completion. So I actually worked through all of those pieces as we were going through. And I can kind of open it up for if we've got any time left for questions. There's contact details if you want them, and feel free to get in touch with me anytime if you've got questions too.